South African hospitals are currently experiencing a severe shortage of nurses. Earlier this month, Health Minister Dr Joe Phaahla revealed that the current healthcare worker-patient ratio is 1 doctor per 3.198 people. But how did we get to this point, and what can be done to fix this problem or to address this issue? We're joined now by the Managing Director at AllMed, Donald McMillan, via our video line. Donald, good morning. It's great to have you with us on the program. It was earlier this month that the Health Minister gave us that patient-doctor ratio. We know that that is, or at least it can be disastrous, having a 3-to-1 ratio when it comes to that patient-doctor ratio.
Absolutely. A lot of South Africans don't realize the actual extent of the crisis that we're in and what is on the horizon with regards to these numbers and these ratios aren't going to be addressed in the short term. It's really a long-term fix, and it's a serious problem that we see going into the future.
Is this an issue that we're facing in the private and public sector?
Yes, unfortunately, a lot of the nurses that are being trained are still being trained in the public sector. The private sector is heavily involved in the education of nurses. However, the numbers are restricted by the South African Nursing Council, the Department of Health, so they don't have absolute freedom to increase the number of nurses within the private sector that they would like to actually train. So, in essence, everyone's fishing in the same pond.
I'm confused by this latest number announced by the Health Minister, though, Donald, because just this year, over the past few months, several hospitals have reported, and I'm thinking particularly of hospitals in Gauteng, that nurses have not had their contracts renewed because of budget constraints. So if we're already under pressure in terms of that healthcare practitioner and patient ratio, how can we afford to let any nurses go?
Absolutely. I think, there are a number of issues that one faces. One being budgetary constraints, two being the capacity to onboard the nurses. So this is where an organization like ourselves provide a vital role in providing an agile link between employers and employees within the employment relationship, and actually acting as facilitators to ensure that urgently needed resources and positions are filled nationally.
Yeah. So actually, I just want to clarify for our viewers, that 3-to-1 ratio is actually the doctor-patient ratio that was announced by the Health Minister. In fact, when it comes to nurses, that ratio is much more shocking than the 3-to-1 that I've just mentioned. In fact, the South African Council of Nurses last year revealing that the country has a nursing staff contingent of 280,000, and in fact, that's equal to one nurse per 213 people.
That's right. That's right. And currently, as of the beginning of this year, there are around about 21,000 nurses that are currently being trained. Bearing in mind, not every one of those nurses will complete their training. It's a 4-year training course. So there's just not sufficient nurses within the process of being trained. There's roughly estimates show that there are about a 47,000 shortage on top of that number of 21,000 that are needed.
Yeah. I mean, what this means for our current contingent of nurses who we know are on the brink, if not already at the stage of burnout. Given the past couple of years of the COVID-19 pandemic, we know that nurses were at the front lines of fighting the pandemic here in South Africa and around the world. If we don't get more nurses on board, how do you reckon this situation is going to unfold over the next months?
Yeah, over the next month and years, it's dire in that, bearing in mind a lot of our nurses are still being headhunted and are emigrating, which adds to the drain of competent nurses. And then, as you quite rightly said, COVID has had a tremendous toll on the emotional and physical well-being of the nurses. And, with wave after wave presenting itself, the nurses don't have, they're not in a fortunate position to actually recharge. So the challenges that are faced, let's hope and pray that COVID really gets under control, and that the nurses and we don't have virus upon virus. Let's hope that the monkeypox virus is not one of great concern, which results in an uptick of occupancy within the hospitals. All signs are that this monkeypox virus won't be a crisis to the same extent of COVID, but it's still early days. Let's see.
So your organization, Donald, AllMed, you focus on providing categories of nurses from state and private hospitals to other institutions. Is that right?
Yes, and we also provide carers within the home care and frail care setting.
Right.
But it's not just nurses. Yes, nursing is the backbone of every hospital setting, but we also provide doctors, physios, pharmacists. So across the board, from a carer right up to a doctor, all healthcare professionals.
So the issue that you mentioned earlier about nurses also taking up jobs in other parts of the world, are we in a position here in South Africa to retain our nursing contingent in terms of our salary scale here? Because the information that I have here places the average salary for a nurse in South Africa within the range of 250,000 to 360,000 Rand a year, and that number is even lower when it comes to entry-level positions at 150,000 Rand a year. I mean, what are they being offered in other countries?
It's very difficult to compete with the exchange rate, but they are offered double to triple those packages. Often they're in situations where they're tax-free packages. These overseas hospitals are providing accommodation, settling in allowances. They're flying them there at no cost to the nurse. And the working conditions, if you look at the patient-to-nurse ratio, are also far better than in South Africa. So it's really appealing for our nurses. And until we can address a whole layer of issues, one being working conditions, two being the financial remuneration, it's going to be very, very challenging to keep the nurses currently in South Africa.
Yeah, certainly very worrying indeed. Donald McMillan, let me thank you for your time this morning, giving us that important perspective. He's the Managing Director at AllMed.